How can I stop my UTIs from coming back? If you've ever dealt with urinary tract infections, you know how frustrating it can be to have them keep returning. The good news is that there are proven ways to reduce the chances of recurrent infections and keep your bladder healthier. First, practicing good hygiene is essential. Always urinate promptly when you feel the urge and avoid holding your urine for long periods, as this creates a perfect environment for bacteria to multiply. It's also helpful to urinate before and after sexual activity to flush out bacteria that might have been introduced during intercourse. When cleaning, wipe from front to back to prevent bacteria from spreading from the anal area to the urinary opening. Avoid using harsh soaps, douches, or feminine hygiene sprays, as these can disturb the natural balance of bacteria in the genital area. Staying well hydrated is another key step. Drinking about 8 glasses of water a day helps dilute your urine and encourages frequent urination, which naturally flushes bacteria out of your urinary tract. For women after menopause, decreased estrogen levels can cause thinning and dryness of vaginal tissues, increasing the risk of UTIs. Using vaginal estrogen creams or tablets can help restore healthy tissue and support the growth of good bacteria, reducing infection chances. For those with frequent UTIs, your healthcare provider might suggest low-dose antibiotics taken regularly for several months. Sometimes, taking antibiotics only after sex can be effective if infections are linked to sexual activity. In some cases, a short course of antibiotics at the first sign of symptoms might be recommended, but always under medical supervision to avoid antibiotic resistance. There are also non-antibiotic options to consider. Methenamine hippurate is a medication that releases formaldehyde in acidic urine, which can help prevent bacterial growth. Cranberry products are popular, but evidence on their effectiveness is moderate. D-mannose, a supplement sometimes used for urinary health, has limited evidence and is not generally recommended as a sole preventive measure. Probiotics, whether taken orally or applied vaginally, currently lack conclusive proof but may support a healthy balance of bacteria. In more complicated or stubborn cases, some patients benefit from specialized treatments like bladder instillations with antimicrobial agents such as gentamicin. These are usually reserved for severe or persistent infections, especially in people who perform intermittent catheterization. It's important to use antibiotics carefully, limiting treatment duration to avoid resistance, and always following your healthcare provider's guidance based on urine cultures to choose the right medication. Remember, preventing recurrent UTIs is not just about avoiding discomfort. Chronic bladder infections and inflammation can impact overall bladder health and may be linked to other bladder conditions. Maintaining good habits and working closely with your healthcare provider can help you manage and reduce the risk of future infections. Always seek personalized advice, especially if UTIs happen frequently or symptoms worsen, to ensure proper diagnosis and treatment tailored to your needs.